Before initiating the removal procedure, the healthcare provider should consult the user card and/or patient chart label for the location of the implant. The exact location of the implant in the arm should be verified by palpation. Mark the distal end of the implant, the end closest to the elbow. A sterile marker can be used. Clean the site where the incision will be made and apply an antiseptic. Anesthetize the arm, for example with 0.5 to 1 milliliter 1% lidocaine at the marked site where the incision will be made. Be sure to inject the local anesthetic under the implant to keep it close to the skin surface. Push down the proximal end of the implant, which is the end closest to the woman's shoulder, to stabilize the implant. A bulge may appear indicating the distal end of the implant, the end closest to the elbow. Starting at the distal tip of the implant, make a longitudinal incision of 2 millimeters toward the elbow. Gently push the implant toward the incision until the implant tip is visible. If the tip of the implant is not visible, there may be fibrotic tissue encapsulating the implant. The fibrotic tissue can be split by continuing to cut toward the distal tip until the implant tip is clearly visible. Grasp the implant with forceps and gently remove it. Be sure to remove the entire implant. Confirm that the entire 4 cm implant has been removed by measuring it. If a partial implant, less than 4 cm, is removed, the remaining piece should be removed. If the implant is encapsulated, make an incision into the tissue sheath and then remove the implant with the forceps. If the tip of the implant does not become visible after gently pushing it toward the incision, gently insert forceps into the incision and grasp the implant. Turn the forceps around. With a second pair of forceps, carefully dissect the tissue around the implant if needed. The implant can now be removed. Be sure to remove the entire implant. Confirm that the entire 4 cm implant has been removed by measuring it. If a partial implant, less than 4 cm, is removed, the remaining piece should be removed. After removing the implant, close the incision with a Steri-Strip and apply an adhesive bandage. Apply a pressure bandage with sterile gauze to minimize bruising. The patient may remove the pressure bandage in 24 hours. The adhesive bandage may be removed after 3 to 5 days. Explain that some pain, irritation, swelling, bruising, or tenderness may occur during the first few days after removal. If any unusual symptoms or infection develops at the insertion site, the patient should see a healthcare professional immediately.